Hi everyone, let's talk about doing a neck lift without doing a facelift. Big topic, let's take a beach walk. So almost a day doesn't go by when somebody comes in my office and says, I just want a neck lift. All that bothers me is right here. I just want you to fix this and give me my nice tight jawline back. My face doesn't bother me. Seems reasonable. The problem is in what component of a facelift is actually just doing your face and what component of a deep plane facelift is actually addressing the neck. And the answer is a large part of the deep plane facelift is what goes into addressing the neck. So a neck lift involves a platysmoplasty or addressing the submental tissue, sometimes the deep structures, addressing the platysma muscle in front and behind the ears. It tightens the neck in this straight back vector. It doesn't do really much of anything in the vertical vector. It doesn't lift things up. That's fine if somebody has absolutely no tissue descent, somebody usually less than 40. And there's a small subset of patients that come in and say, I've never liked my neck. I've never had a good neck angle. And they're candidates for an isolated neck lift, where that's more of a reductive surgery. We go in through the submentum, reduce the tissue, remove deep fat, remove submandibular glands, tighten the platysma, sometimes have to take a small amount of skin. And that's probably the only case where you can really get away with doing an isolated neck lift and not addressing the face. The problem comes in as we get older, the tissues from above start to descend, start to get hanging skin over the jawline, start to get jowly. These are things that age us, they're hanging down. Most people's concerns are right around their mouth. And so that hanging tissue isn't addressed with an isolated neck lift. And so if you do that neck lift just in the posterior component and you do nothing to lift, all you're going to do is draw attention to this tissue hanging over the jawline, the jowling, and the excess under here. This skin under here is actually the toughest area to address with the face and neck lift. And the old traditional SMAS lifts, this under here is where you would most often see them fail, because this tissue has to be mobilized and be moved upwards. These mandibular ligaments need to be released and the tissue needs to be moved actually up in this direction. It's really amazing when I do a deep plane facelift and I've done the neck and I've done the facelift on one side and I'm just starting to do the other side, and I'll often notice there's a ball of excess skin and tissue right here compared to the other side that's already been done. And the reason for that is it hasn't been mobilized upwards. And then when I release that main facial ligament, the zygomatico-cutaneous ligament, and these attachments down the smile muscle, the zygoma muscle, the zygomaticus muscle, that is when this all mobilizes and moves upward and it magically disappears. So the way to get a good neckline is by doing a good deep plane facelift. And in just doing an isolated neck lift with no facelift, yes, you could actually make things worse. So there's my answer to the question why I rarely will do an isolated neck lift, because it rarely will be successful in addressing what's bothering a person. So thanks for coming on my beach walk. And if you have any other topics you'd like to hear me talk about during one of these, please leave them below. Thanks. Have a good night.